everyone, my name is Erika and I am a volunteer with the State Health Insurance Program here in Georgia, better known as Georgia Cares. I want to take some time today to talk about Medicare and give an overview of when you can enroll and the different enrollment periods. So before we jump into that, I do want to talk about what Medicare is. So Medicare is the federal health insurance program that covers adults over the age of 65, individuals with disabilities, and those with end-stage renal disease. Now, with Medicare, there are three main parts to Medicare. So there is Part A, which is the hospitalization, Part B, which is the medical insurance, and then Part D, which is the prescription drug coverage. Now, all those parts cover different things, right? So like I said, Part A is all of your hospital stuff. Part B is just your regular health insurance when you go to the doctor. And Part D is your prescription. So when you go to the pharmacy, things like that. Now, I do want to talk about Part C. So there's another part of Medicare called Part C, and that is through the Medicare Advantage plans. So Medicare Advantage plans are plans that combine Part B and Part A kind of together and can sometimes cover things that original Medicare won't. So sometimes they'll have things like gym membership, sometimes they'll cover vision, hearing, dental, things like that. Now with the Advantage plans too, those generally do have the prescription coverage already included in them. The catch, so to speak, with Medicare Advantage plans is that you're going to have to use healthcare providers that are generally in network, and they tend to be very zip code specific. So if you live here in Georgia, and it can even be really county specific too. So even if you're in like Butts County and you move up to Coweta County, your Medicare Advantage plan may not cover the new doctors here in Coweta County. So it is very specific in who can be served and who you can go to. Now, the thing with those is that those plans also do have a set limit on what you're going to have to pay for out of pocket each year for covered services. And sometimes those plans do offer non-emergency coverage out of network, but they're generally at a higher cost. So with Medicare Advantage plans, it's really you stay in network, you stay with the providers that you know take your Medicare, and you do have a limit on to how much you spend. Now, I do want to talk a little bit about the Medicare Advantage open enrollment period. So that period is from January 1st through March 31st each year. If you are currently enrolled in an Advantage plan, you can take this time to switch to a different Advantage plan or switch to original Medicare with a separate drug plan. It is important to note that you can only switch plans once during this time. So if you switch to a different Medicare Advantage plan or if you switch to original Medicare, you'll only be able to do that the once, and you'll have to wait until the following year, the following Medicare Advantage open enrollment period, to switch again. Your new coverage is going to start the month after you sign up. So for example, if you were to switch plans in January, your new coverage would start February of 2023. I do want to reiterate something important though, that during this enrollment period in particular, you can only switch into another Advantage plan or switch to original Medicare. You cannot switch from original Medicare to an Advantage plan or switch drug plans. Switching gears for just a second, I do want to talk about original Medicare for a minute. And that generally is comprised of Part A, the hospitalization, Part B, the medical insurance, and then you do have to have a separate drug plan if you want prescription drugs covered. Now, there is no real set limit as to how much you're going to spend each year with original Medicare, but the perk to original Medicare is that you can take that all over the country. Generally, most doctors are going to accept original Medicare. And talking a little bit about the original Medicare and the general enrollment. So the general enrollment happens every year from January 1st through March 31st, and this is the time to sign up for that Part B, the medical insurance. Now, if this is your first time signing up for Medicare, if this is the first time that you've become eligible for Medicare, you have from 3 months prior to the date of your eligibility to 3 months after to sign up for Medicare. That's a special enrollment period. But if you do miss that deadline for whatever reason and you sign up during the general enrollment period, you may have to pay a late enrollment fee for your Part B and your Part D as well. That late penalty is 10% for each year that you could have signed up for Part B but didn't. Now, that penalty is added to your Part B premium, and your Part B premium may already be higher in general just due to your income. And I do want to stress here that it is not a one-time late fee, but rather it is a penalty that you're going to pay for as long as you have Part D coverage. Or Part D. The Part D late fee is a little bit different. Late enrollment fee is a little bit different. But generally speaking, you're going to have that penalty throughout the entire time that you have Part D and Part B. Now, there are a couple of ways to avoid that fee, right? So if you sign up during a special enrollment period, you would not have that late enrollment fee. So for example, if you and your spouse are working and you have comparable or creditable coverage, and then they stop working and you lose eligibility for your current health insurance, your employer-sponsored health insurance, then you'd be able to sign up for Medicare without having to pay a late enrollment fee because you had other coverage when you first became eligible for Part B. And I also want to talk about the fact that if you are considered low income and you qualify for help paying for your Part B or Part D premiums, you will likely also not be subject to that late enrollment fee. And so let's talk a little bit about that help that's for paying your premiums. So there are programs out there that are called Medicare savings programs that help individuals with low income pay for their Medicare Part B and Part D premiums, co-payments, and deductibles. There are different levels of help that have different income limits. So the first level of help is called the Qualified Medicare Beneficiary, and that has an income limit of 100% of the federal poverty level. Now this year, that amount, for 2022, let me clarify, that amount is $1,132 a month. And the Qualified Medicare Beneficiary pays for the Part D premium, any co-payments, and any deductibles that you might have. The next step up is called the Specified Low Income Medicare Beneficiary, and the income limit for that is 120% of the federal poverty level. And that again is $1,359 per month for 2022. And that pays for the Part B premium only. The next level up and the third level up is called the Qualified Individual, and that is 135% of the federal poverty level, or $1,528 a month, again in 2022. And again, that program only pays for the Part B premium. Now, all three of those programs do have a resource limit of $7,390 for a single person. And I do want to say, I know I'm saying 2022 a lot, and that's because those income limits are not going to change until April of 2023. And they actually may take a little bit longer to change too, because right now we are still in the public health emergency, and anybody who currently has any type of Medicaid coverage will not lose that Medicaid coverage until the public health emergency is done and the state recertifies everyone. The other piece, the other help paying for Medicare cost, is called extra help. So that is help paying for the Part D premium. And in order to qualify for that Part D premium, an individual does have to have resources of less than $16,660 and have monthly income of less than $1,698. Now those numbers are accurate for 2023. And I do want to say that there are two levels of extra help. So there's full extra help and partial extra help that are based on income. Now, you'll also qualify for extra help automatically if you are eligible for any of the Medicare savings programs that I talked about before. So before I sign off, I just want to say that I know that signing up for health insurance, especially Medicare with all of the plans and the different time periods and all of that, can be really confusing. So please, please, please don't hesitate to reach out to us for help discussing your Medicare options or if you have any questions. Thank you so much for your time today.